Today on CityCast Boise, Idaho's Medicaid expansion is once again in the crosshairs as the legislative doge scrambles to deal with our budget shortfall. At the same time, our state has earned an unsettling distinction of having one of the highest rates of uninsured children. And if you're looking for a break, a new local play is bringing laughter and thought-provoking social commentary. It's Friday, October 3rd. I'm Lindsay Van Allen, and this is what Boise's talking about. Happy Friday, everyone. And joining me to dive into the biggest local headlines of the week is friend of the show, Ashley Townend. Thank you for joining me again, Ashley.
Thanks for having me again. I'm so happy to be here.
I think one of the biggest headlines, and you brought this to my attention, was about how the Idaho Doge task force that has been assembled for the legislature is diving into cuts they can make because we've got some budget issues in Idaho now. And one of the things that they're looking at cutting is Medicaid expansion or repealing it. They're really looking at a lot of different options with that. What really stood out most to you, Ashley, about this story and what this task force is looking at doing?
I think what stood out the most for me was I'm all about making sure everything's clear and needing to check if anything's kind of not working for the state fiscally. But it felt like kind of like there was a floor debate happening near the end and not just asking questions. This idea was brought up about work requirements and giving people handouts apparently makes people not want to work. And it's Halloween season. And I think that maybe there's something there. And these, quote, socialistic type programs are quite scary to some lawmakers. That's kind of what I got out of it.
I know that when people hand out candy to my kids on Halloween, they stop yearning for the mines. So it tracks. It tracks.
Right.
No, I thought one quote that stood out to me was from Representative Josh Tanner from Eagle, who said, "This is no longer that hand up that it was sold at. This has now just become a straight handout program." I have some thoughts on that. As somebody who has been on Medicaid in Idaho, for listeners who don't know, in a past life, I was Mormon. I did the Mormon young mom thing. My husband was still going to school. We had kids very early, and we were on Medicaid. And so that was how we were able to afford any kind of healthcare. And funny enough, actually, I was a libertarian while I was on Medicaid. I can't explain that. You can do really crazy things in your mind when you want to, but I guess I take major issue with this representation from Representative Tanner because it was life-saving for me to have access to that Medicaid. Like, that saved us. And now we no longer need to be on Medicaid, which, we used it when we needed it, and now we don't. And I happily pay my taxes for people who do need access to that program. And it's just, Idahoans in 2018 overwhelmingly supported this Medicaid expansion. And it just, this is one of those issues I just get so upset about when people talk about these programs like that, because they were so essential to me and my family. And there are other Idahoans that need them just as much.
Right. Yeah. And you're right. All of the details aside, this was something that was brought by voters. Most of Idaho brought this forward, and this is why we have it. And to strip it away is just so defeating when most of Idahoans are the ones that wanted this and throwing out these ideas of we were told that it was going to be cheaper and now it's not, and forgetting the fact that a pandemic happened and maybe that's why the numbers look a bit different and, all these ins and outs. But at the end of the day, taking away data after data after data tells us, and I'm not cherry picking these numbers, that taking away basic healthcare, which is a human right, not a privilege, this doesn't make people want to work more. It really doesn't. And so where we're getting this idea is wild to me and scares me for the future of Idahoans, the future of, I guess, most of this country, but mainly the future of Idahoans. And these are not people, these are people that are working. Medicaid expansion involves people that are
Yeah.
working. So where are we getting this idea that handing out, quote, handing out free healthcare is making people not work is just so disheartening. It's very
Yeah.
disheartening.
I was
Yeah.
going to say, I dislike that representation so much. When I lived in Rexburg, when we were Mormon, having kids really young, everyone we knew was on Medicaid. If
Mhm.
you want to look at what population's on Medicaid, it's Rexburg, and everybody was working. Everybody was either
Yes.
raising small kids or working. So it's such a misrepresentation that just keeps getting repeated. The other thing that I take issue with is they're looking at work requirements. They're looking at kicking people off who make between 100% and 138% of the federal poverty guidelines and shifting them to private insurance through the state marketplace using federal premium tax credits. Now, that initially might be like, hey, yeah, that sounds feasible. That sounds like it could work. But the premium tax credit is set to expire this year. So this is just, it feels like this Doge task force is looking for ways to offload people off Medicaid and then leave them absolutely without options because there isn't going to be this federal premium credit so that people can afford insurance. Like it's really like they're going to kick people off and then they will have no options. And they don't suddenly not need healthcare if they've been kicked off. But I feel like in the conversation they ignored that. They didn't talk about the fact that premium tax credit is going away. They just pitched it as like, oh, this is a great cost saving measure.
Right. Yeah, it wasn't mentioned at all. And as just as a community member, it makes me feel like our needs aren't being put first. It's all about the budget. It's all about what's best for them, for their whoever they're chatting to. Not that I want to like put any of that out there, but it does feel that way. And it's giving off those vibes, especially when you just keep diverting back to this idea that we're making people lazy, you know. We're not making people lazy.
We give billionaires handouts all the time.
All the
All the
time.
time. Like we give handouts to the rich always.
All
And
the
do they
time.
stop working? Do they stop like no, that's not how this we have to get rid of this. It's such an anti-poverty line that if we give people things they'll stop working. It's can we try it on the billionaires? Let's try it out. Let's try it on the billionaires.
Right.
Let's stop giving them things and see if they'll work harder.
Right, exactly. And let's not forget about House Bill 345. The state is already putting in these work requirements. So when I was watching the Doge task force do their thing, I kept being like, what about but that bill? Like are they not happy with that bill that was passed? I mean, Democrats didn't like it. The Republicans got it. You know, I'm a bit confused. I'm confused because they're already getting the work requirements that they wanted, and it's still not good enough. It was an uncomfortable watch. You know, my understanding was that task force is to study, review, not debate, and it started to get. I felt like in the end there I was watching floor debates, and it was an interesting watch. I encourage everybody to, if they can, go and watch that and come up with your opinions for yourself, but those are mine.
Yeah, and I also another factor that I look at when we're having this conversation about how can we save money. There are so many things in government that initially seem like they're going to save money, but then in the long run, like for 1 year, then politicians can turn around and be like, "I saved you money," and then you
Totally.
turn around and in 10 years, it costs millions, if not billions of dollars. And one of
Right.
those things I think is kicking people off of
Hmm.
Medicaid
Hmm.
because like I've said so many times on the show, they don't suddenly not need healthcare. They're just going to go to the emergency room, which is going to cost the state more. It's you will pay
Yep.
more for that than what you're paying now because there isn't preventative care. They are not going to be getting the care that they need. And I just need everybody to remember that studies and data are indicating that healthcare premiums are potentially going to rise as much as 20%. And for people who are counting on the government subsidies, the coverage costs could soar 75% or more per study that was just reported on by PBS. So if we're kicking people off Medicaid, we aren't suddenly going to not be helping cover costs for this. Like, costs are going to rise. Our insurance costs are rising. And one of the main things that they said is driving that is emergency room visits. So when people are not getting preventative care and are going to the emergency room, it's costing you more with your health insurance. And so it feels like this is going to be some quick grab where the legislature can be like, see, we saved this many millions of dollars. And then all of our health insurance costs are going up. And they're just going to pretend like that wasn't a factor.
Right. Those basic needs are still going to be needed. And we all know Maslow's hierarchy of needs, right? Everyone needs those basic needs. And the very bottom of those basic needs are above work. We're going to be going to ER rooms, like you said, regardless. This will just deepen the hardship of families in Idaho, which will eventually we all will be paying for, and then I assume that we won't hear about it from then, because I don't. Yeah, I'm a bit concerned. This is something that Idahoans wanted. I think the people of Idaho are very smart, and we know why we wanted it, and now it's just being ripped from us.
All right, Ashley, jumping from that heavy topic to an adjacent topic that, Idaho made another list. We came in number 2, which is, it's interesting. We usually come in number 1, but this is a study where we came in number 2. And that was a study from Georgetown University School of Public Policy that found that the number of uninsured children in Idaho rose 40% from 2022 to 2024. And that was one of the biggest increases of uninsured children in the entire country. Only Texas was worse than we were. So, Ashley, we're number 2 in uninsured children.
Yay. I mean, in my head, number 2 stands for some things that are pretty dirty. So it tracks in my mind. I'm sad to say I'm not shocked. Yet again, like, here we are. These are basic needs. These are children. These are the very population that we should be concerned about. And if this doesn't open up lawmakers' eyes, I really just don't know what will, because these are children. Kids get hurt all the time. So what happens when a child gets hurt? Yet again, here we are. They're in an emergency room. That cost is going to go somewhere.
So this was reported by Sarah Cutler with Idaho Statesman. Sarah found that in many cases, people were disenrolled by mistake. So there were 18,000 Idahoans who were disenrolled from Medicaid from April to September 2023. And like, they went to go get their prescriptions. They needed to go to a doctor's appointment. And that's when they found out they'd been disenrolled. And they were later found to still be eligible and put back on the rolls. How does this happen?
Right. I mean, the procedural reasons, the bureaucracy issues. How are we accidentally disenrolling people? And even worse, them not knowing about it. Taking the trip to a provider and being there and not knowing that you're not. I mean, that alone, that trip can be challenging. It can be hard to get to some of these places for folks, especially in rural Idaho. And then to just get there and not have your insurance for your child is so scary and so disheartening. And just, that is not the role of the government. Our government is not doing what they're meant to do, which is to make sure that the people of Idaho have what they need and have their basic human needs, especially for children.
I've been thinking about this article since it came out, and 50,000 children lost health insurance over the period of this study, and 70% of those disenrollments were caused by procedural issues. So it was an error. They were eligible for coverage, and a lot of them, well, I mean, some of them later were enrolled, and some of them were not. Like, how won't somebody think of the children?
I know. If I were a legislator, I would want to have all of those questions answered. I would want to know how many people in my district, how many children in my district weren't covered and why, and how we can fix that, because that is the role of our government.
As a nurse who's primarily worked NICU and pediatrics, this is just very concerning to me. I feel like maybe I'm off base here. I don't think so. That children should really be the focus of a lot of the things we're doing. I mean, a huge amount of our budget is going to schooling for our children, for, making sure that we are creating the best situation that we can for our children. And so to have us be number 2 in the nation for kids who are uninsured, and then to find out this is because of clerical errors. This is, a lot of these kids didn't know, these families didn't know that their kids were disenrolled. We can do better. Idaho, we can do better. Like, what are we doing?
We can. It's clearly not something that can't be fixed, because if it's just, oh, we messed up. Okay, great. Let's look at the problems. Let's make sure it doesn't happen again, and let's fix it, because this seems like something that could just be fixed overnight, and we can learn from our mistakes and make sure this doesn't happen again. And if someone's kicked off, let's find a way to make sure that they know that. I'm still so concerned that people had no idea. I want to know if I'm kicked off from my health insurance.
Yeah. No, I mean, like, one of my kids just had a very sudden emergency health scare, and they needed a fair amount of care. It's, kind of an ongoing situation. But like, if I had gone to the doctor and realized they don't have health insurance, like we had to go a couple of places, we had to get a couple different types of care, that could have cost us thousands of dollars.
Yeah.
And that's the other thing is healthcare is not cheap. And so when these people think that they're enrolled, they think that their child has health insurance, and then you have life happen, that can be the difference between you're paying your copay or you're paying, toward your deductible, and now you've got a $5,000 ER bill because your child needed care. Like, what kind of a situation is that putting Idahoans in?
Exactly, especially when we know most Idahoans are on the living paycheck to paycheck. That one bill, that could be just a catastrophe for a family. And this isn't just, oh, oops, we messed up. These are people's lives. These are people's children. We should be more than just concerned. I'm furious. I'm pissed, and I want answers, and like you said, I also hope that there's a follow-up. I'll be refreshing my browser often to see if that comes in.
Yeah, I was going to say, if the legislature is looking for something to focus on to quote unquote protect the children, I feel like this is it. We found it. We found it for you. We don't need to be arresting librarians. We can just make sure our kids have health care.
Yep, absolutely.
Okay, Ashley, I'm hoping we can kind of lift this. It's not all bad. That's why I have picks of the week. It can seem like there's a lot not great going on. We're topping some terrible lists, but there are some really fun things happening around town this weekend. And one of those is the 3rd annual Idaho Cider Fest. And for anybody who maybe doesn't know, I'm not really a beer girly. I've tried. As I said previously in this episode, I was raised LDS or Mormon, so I didn't start drinking until, late 20s. And I've tried. Beer's not really my thing. Every so often I'll give it a try. I think it's not for me. But I love it for people who love it. So I'm very excited about this because I do love a cider. I think ciders are fantastic, and we have some places who make amazing cider that are local. So anyway, this fest is Saturday, October 4th from 12 to 6 p.m. It's on Bannock Street from 8th to 9th Street, so right downtown, going to be really easy to find. And it's free to attend. And they just ask you to buy tokens. So you're going to buy some tokens and then can trade those to try different types of cider. And they'll have festival cups available on site, or you can bring your own cups. So, I mean, if you've got your Tree Fort cup, you've got, all these different cups, please bring that. They're going to have ciders from Idaho, Washington, Oregon, Colorado, Montana, all kinds of different ciders. And then they're going to have food from 10 Barrel Brewing and Funky Taco. And there's going to be games and entertainment. I just think it sounds like it's going to be a fantastic little festival for us cider lovers.
Yeah, sounds like a blast.
Okay, Ashley, what's your pick of the week?
Well, my pick of the week, I just love the power of storytelling. And I love going to plays. Whether it's professional theater, community theater, I think they're all great, powerful. And the Boise Contemporary Theater is doing a show called Eureka Day it's October 1st through the 18th. So they've already been doing their preview shows, and it seems like I've never heard of the play. It seems really awesome, and funny, unsettling, relevant satire, and that kind of plays on, our post-pandemic world. But it seems like a really good time. And, every time I have a pick of the week, somehow Matt Melton is involved, and he's in this show, friend of the pod. So I unintentionally picked another pick of the week that had to do with Matt Melton, which was hilarious. But he's in the show, which is a really big deal, and I'm really, really excited for him. And I can't wait to see it. I got my tickets already. I'm going tonight. So
okay, I have to tell you. Okay, I saw it on preview night. I've already seen it. It's a great pick of the week. I highly recommend it. It was a fantastic show. There were parts of it where I was like, "Ooh, that's too accurate."
Yeah.
So, but in the best way, in the uncomfortable tension of the world we live in kind of a way.
Totally.
Matthew does amazing. The entire cast does an incredible, incredible job. It was so funny, though, to see Matthew Melton, because he would say things like he would respond kind of how he's responded to things on the show when we have conversations. Yeah. And so it was so funny to see him in this character also being Matthew Melton. It was really it was really fun to watch.
That's awesome.
Yeah, they did an incredible job casting for this. I know they have definitely put so much work into it, because it showed the acting was really, really well done. I highly recommend, if you can get tickets for this, if you are interested in this, it was a really, really good show.
Good. Yeah, I can't wait. And I don't know if you haven't been to that theater, it's a black box. So it's very intimate. It feels very intimate. You're kind of, on the stage with them rather than like looking up to a stage. Black box theaters, to me, are my favorite, because you just kind of feel like you're a part of it a bit more. Very, very intimate. And it's just such a good vibe there. They have a little bar too. So I can't wait. It's going to be a great date night.
Well, Ashley, thank you so much. These were some heavy topics, some really tricky headlines. So I really appreciate you taking the time to come on the show and break them down with me.
Absolutely. Thank you so much for having me.
That's all for today here on CityCast Boise. The show is produced by Evelyn Avitia, Frankie Barnhill, Elizabeth Kama, and me, Lindsay Van Allen. Blake Hunter writes our Hey Boise newsletter, and our music is by Up Is the Down Is That and All the Kimonos. If you enjoyed our show today, leave us a review. It helps other people find us. We'll be back on Monday with a look at what federal cuts to Planned Parenthood mean for Idaho. You won't want to miss it.